In this lesson, I'm going to be explaining preterm labor for you and what we need to do for this patient and how you will be a part of it. Let's first look at some important terms. So first term, our preterm labor. So what is term? Term is a patient that is 37 to 40 weeks gestation. Our preterm patient, that is going to be before 37 weeks, but after viability. So this is a patient that is 20 weeks to 36 and 6 days gestation. And then viability. So what is viability? Viability is something that different people say different things, but it is considered to be at 20 weeks that the fetus is viable. However, the reason why this is conflicting and gets a little confusing is because hospitals don't consider viability until the point that they would resuscitate. No hospital will resuscitate a fetus that is 20 weeks if it was born at that time, just because of ethically all the things that can go on with that. So most hospitals will not revive a fetus. The earliest is 23 weeks gestation, and not even all hospitals do that. Usually 24, 25 weeks is going to be the week gestation that they'll revive. Around my area here, no hospital in this area will revive a fetus before 25 weeks. So most textbooks will refer to viability at 20 weeks. So that's what you should know for this. But I just wanted you to be aware of this whole piece, the 23 weeks to 25 weeks, because you'll hear conflicting things about that. So for us, the big thing, viability is at 20 weeks. Term deliveries are 37 to 40 weeks, and preterm is anything between 20 weeks and 36 and 6 weeks. All right, so now what is preterm labor? So remember, our preterm definition was 20 to 36 and 6 weeks. So preterm labor is labor that occurs between that time, 20 to 36 and 6 weeks. Babies are supposed to be born at around 40 weeks, right? That is when we consider that the baby's done cooking. So because of this, the babies are born early. They are underdeveloped, right? They're not ready to be born. So a big thing that they will have is their lungs won't be fully developed and functioning, and they might need a little bit more support with that. Their brains aren't as developed as they would be if they were 40 weeks. So these preterm babies are going to sleep more because their fetal brain develops, the baby's brain develops during sleep. So that's why they're going to sleep more when they're born early. Just think of the womb as an oven, and whatever you are cooking comes out too early. It's just not done cooking. So now what is our assessment going to look like for this patient? The patient could have regular contractions or even some slight cramping occurring. They might have low back pain, and that's because the contractions can radiate to the lower back. So you might see that. The patient might have a change in vaginal discharge. So maybe it was thick before, and then it's going to go to thin and brown or bloody color. So just a change in that vaginal discharge. They might have PPROM. So this is our preterm premature rupture of membranes. So you might have a small little leak. They might have a big gush. And so we can confirm that with nitrazine to see if it is true that they have amniotic fluid that has ruptured. And then pelvic pain. So they might feel lower pressure happening. And that's because that fetus has dropped now lower into the pelvis with contractions. They might have that pressure. And they actually might feel like they need to push. So let's say you've got a patient and they've been assessed and they have a bunch of these different things and are confirmed to be in preterm labor. So let's look at what our management will be for that patient. So what are we going to do? Well, first we want to attempt to stop the labor. So we can do this by administering tocolytic drugs. Terbutaline is a big one for this. And terbutaline is going to be given, and that is going to just help stop contractions from occurring, to relax that uterus. We can give IV fluids. So a lot of times if a patient's severely dehydrated, it can cause contractions. So if we hydrate, it could even be oral hydration, then we want to do that to help stop contractions. We always have a little joke on the unit that around Labor Day and Memorial Day weekend, these women go out to be with their family and have a picnic, and it's super hot and they get all dehydrated and they come in contracting. So we just want everyone to stay hydrated on those so that it keeps them from preterm labor. Then monitoring. We're going to monitor mom and baby. Hopefully they can get rehydrated, and on the monitor their contractions will stop and they can get sent home. We are going to do possible bed rest for a patient. So remember, if the patient's on bed rest to help stop contractions or slow labor, then she's going to be at risk for blood clots if she's on bed rest for a long time. So just things like those compression hose and things to help prevent blood clots. And then infection prevention. So this is specifically for a patient that has that premature or preterm premature rupture of membranes. We want to keep her in labor as long as, or in not in labor, keep her pregnant as long as we can. So because of that, if she has no barrier there anymore, she's going to be at a huge risk for infection. So everything we can do to prevent that. So not doing as many cervical exam checks and all of that's going to help keep the patient away from infection. For our education, this patient needs to be educated on the signs to watch for preterm labor. So contractions, if she has any leaking of fluid, if she's feeling any pressure or pelvic pain, any bleeding, even if it's just spotting, we want to educate her on that. If she has to be put on bed rest, then we want to educate her on the importance of this. She needs to know the why behind it, so that way she hopefully sticks to it and does it. Safety and infection control are going to be our nursing concepts for someone with preterm labor. So we need to do the best we can for this patient to keep her and her fetus safe and prevent infection because these patients are at a greater risk. So on to our key points here. If you remember these things, then you'll hopefully remember what you need to know about preterm labor. So preterm labor is considered 20 to 36 and 6 weeks gestation. The patient might need to be put on bed rest, so that we would want to watch out for any blood clots, which will be part of our management. Tocolytics is a piece of our management. That's our terbutaline, just to help stop contractions. And then symptoms to report. So any contractions, low back pain, pressure, rupture of membranes, or an increased discharge and spotting, all signs to report. Make sure you check out the resources attached to this lesson and review the symptoms and how you will manage this patient. Now go out and be your best selves today, and as always, happy nursing.